안녕하세요. 미사웰치과 임상철 원장입니다. 晚上好，我是韩国卫牙科医院的林상철 원장. Hello everyone. It is March at last. Spring is coming. I'm Sang-Chul Lim, today's moderator. I'm happy to be with you again in 2025 by Dentium live surgery and follow-up. As always, today's live surgery will be performed by Dr. Jangan. The topic for today is bright TL implantation with collagen graft 2 and connective tissue graft on upper anterior area. We will be able to learn the management of elder persons' anterior region implantation and how to easily perform implant surgery with collagen matrix like a Dentium Collagen Graft 2. Okay, let's take a look at today's case. Bright TL implantation, connective tissue graft, and collagen graft 2 combined case. About the patient information, 78 years old male person. His chief complaint was, I want to get the front tooth supported by implant. Past dental history, tooth extraction due to root fracture 6 months ago. Past medical history, non-specific. As you can see, this panoramic view and cone-beam CT showing us about the patient condition. Actually, before extraction, this canine and lateral incisor area have some big depression, and after this lateral incisor areas of cone-beam CT view shown us about narrow ridge width. In the oral view, intraoral view of our patient, as you can see, very narrow and thin ridges remain, and also have a big depression, especially about lateral incisor area. This area was the panic. So today's surgery plan is implantation on the 13 area, the canine area, using bright tissue level, diameter 3.5, and combined with control augmentation using collagen graft 2, the collagen matrix, and the pedicle graft. About the bright tissue level, many times already introduced to you. This bright tissue level, the external connection, the beveled external connection type, right? That is main specific distinguish the difference between another type of tissue level picture. So thin, deep, aggressive thread was achieved, and final drill only simple drill and implantation. That's it. Very simple drilling protocol and osteotomy procedure. So that is big advantages to apply narrow thin ridge or elder person. About the collagen graft 2 is here. This collagen graft, basically collagen matrix. So this collagen matrix working as the promoting wound healing. So it is a little bit the promoting activities, and epithelialization, make a faster epithelialization around this wound area. So if you use this collagen graft, the collagen matrix matures as truly different the phenomenon and the healing processes compared to the barrier membrane, right? So the barrier membrane basically blocking the blood supply. Sometimes this barrier membrane, the blocking the soft tissue healing processes. However, this collagen graft 2, the collagen matrix matures, is highly achieving the faster soft tissue healing. So the open wound healing style, the procedure, or the transmucosal style GBR procedures are good indication for using this collagen graft 2. So usage is here, indication is here, ridge preservation. We can use ridge preservation as I mentioned before. This one is porcine tendon derived type 1 collagen sourced. Let's think about this similar case. This similar case is shown you for more comprehensive understanding before starting today's surgery. Narrow implantation and ridge augmentation on anterior defect here. So, but number 11, right? The central incisor of upper. What about this ridge? Actually, as I mentioned before, as you can see, just before the cone beam CT view, thin, narrow ridge existed. So, flap reflection and some bone augmentation with the implantation is necessary part of procedure. So, first incision here, and we can see clear the existed narrowed ridge. So, and checking the width and some depression or some defect, and after that we're going to do drill for making osteotomy, and then placing the implant fixture. In this case, bright TL was used, diameter 2.5, length 9 mm. So this bright TL to make easier and make simpler this kind of narrowed ridge, upper anterior or lower anterior, so it doesn't matter, the same. And after that, connect with the scan abutment cap and checking the thrust ISV value. This one is very similar to ISQ value of osteomental. So this 6062 is not bad. And soft tissue harvesting and moving to this donor site, recipient site from the donor site. And sometimes we're going to use collagen graft 2 combined with connective tissue. So before applying this collagen graft 2 or connective tissue graft, this osteogenic collagen first applied on the inner side. Cause of some of bone will be made by using this osteogenic collagen bone grafting material. So the concept is very simple, right? The inner surface, contact bone or some exposure areas of implant fixture should be applied bone graft materials like a xenograft or some autogenous bone graft, that doesn't matter. And then covered with some another graft materials. Sometimes we can use osteon-free collagen like this alloplastic material for making the bone volume, the volume maintenance. And sometimes we can use this osteogenic collagen, the collagenated bone, and also covered with collagen graft 2 as the barrier membrane working. However, this collagen graft 2 is the difference between the barrier membrane. So this collagen graft 2 is not exactly the same working as the barrier membrane. This one is working as a wound healing process, promoting wound healing process. That is true. Okay, and after that, if possible, we can harvest this connective tissue from the maxillary tuberosity area, the palate area. We're going to do adding this collagen graft and connective tissue graft to make a volume enlargement. And after that, suture and inject PDRN to make faster soft tissue and the hard tissue healing. This PDRN is hot item nowadays. So more and more the doctors starting to use this PDRN injection. Okay, post-op view is here. And the panoramic view or post-op panoramic view. So central incisor area, the panoramic view shown us about the bright TL fixtures too much narrow compared to the edentulous span. However, if you see this cone-beam CT view, why should doctor using this narrow diameter fixture? We can clearly understand cause of narrow reach. Due to narrow reach, it is impossible to bigger diameter. So, doctor operator want to have this bright TL in the circled hole of native bone. So that is main issue to use this bright TL implant fixture. And then some of bone grafting materials added to labial surface to making new bone formation or some enlargement of the tissue. Okay, the iOS view here. The ordinary speaking, generally speaking, in the Dentium company's concept, Dr. Chung's concept, iOS is using for temporary. And final, the process is always taken by BTS style, the bite-tray impression technique. Cause of BTS is more accurate than iOS. Actually, a single is no difference anymore. However, long span or free end style or edentulous areas, the bigger and bigger cases may be big difference between bite-tray technique and iOS. So in this kind of case, actually, the iOS is no problem anymore to make a final restoration. However, in the Dr. Chung's protocol, always just after the surgery, taking the intraoral scan and sending the CAD room and make a temporary with the custom abutment or the temporary abutment, doesn't matter. And then after soft tissue healing, the taking again by tray technique for final restoration impression, and then deliver the final restoration from this kind of technique. This photos healing second days. And the provisional restoration already installed, connect with already installed the bright TL 2.5 diameter fixture. So the screw hole located on labial, it doesn't matter. In the provisional restoration case, actually screw hole doesn't matter. However, in final restoration, maybe these screw holes disappear because of some doctors want to have a cementation type at this kind of angulation, or the 15 degrees angle to the palatal will be applied. And during the healing stages, 2 weeks later, we can see this healing status of soft tissues. Soft tissues have the still big volumes on labial space, labial surface, due to the insertion of bone graft materials and collagen graft too. And the healing second 2 months later, healing photos here. Soft tissue is more stable and keratinized tissues, keratinized gingivals appeared. And however, interdental papilla is very difficult to make a reconstruction in this kind of case. So if you want to have a perfect papilla reconstruction, maybe you may have more surgeries to reconstruction of papilla. Okay, today's surgery is here, and already incision is started on the crestal area. Crestal incision first, and now Dr. Chung make the papilla preservation incision on this lateral incisor area and make a clear cut. Once more, making a clear cutting. for full thickness cleft reflection, the clear full thickness cleft reflection. Okay. First, before starting the surgery, we should think about the incision line, right? The incision line is best, the actually important factor to making a better aesthetic and a good healing, especially on the aesthetic anterior region. So in this case, Dr. Chung want to have a papilla preservation incision line. So the vertical incision from 1 or 2 millimeter from the neighbor teeth clavicular area. So the papilla preservation incision is already done. However, this number 14 area, just simple clavicular incision was made without any vertical incision. And now he is using the cavitron to make root planing. So Dr. Chung is periodontist, so he always use this kind of instrument to make a root planing, cleaning the neighbor natural teeth root. Okay, the root planing was done. That he is making initial drilling with a Lindemann drill, very narrow ridges, widths. So making a point for the number 13, the canine area, and starting with the Lindemann drill. Okay. First, the Lindemann, the ordinary diameter 2.5, 2.0, actually 2.0, and second Lindemann 2.5 diameter. And checking the pass using the pass pin. Today's surgery is very simple. However, how can we make this kind of elder person management on the anterior aesthetic area? That is key factor. We are able to learn managing the elder patient, about 80 years old man person. Okay. The already pictures are prepared and inserted into the osteotomy site, diameter 3.5. We can see just only 2-step drilling, right? Only 2 drillings, and that's it. He was made on the side drilling for to maximize initial stability on this area, and removing plastic cap. This cap is working, the protecting this screw thread, the inside of the implant picture. The gingival cup is only one size, 1.5 millimeter from the top portion of thread and then the basement of bevel. So 1.5 gingival cup, external connection, beveled external connection type is the characteristic of bright bone level, bright tissue level implant fixture. And connect with a digital abutment. The plastic cap is handle. And this digital abutment, brand new digital abutment, have 3 notches. 1, 2, 3. 3 surface notches here. So promoting and easier the intraoral scanning, the detection. Yeah, make it easier. And after that, the pushing into this defect area using the collagen graft tool. This a little bit the depression area, the second lateral incisor area. There are many different ways to make augmentation, the volume augmentation procedure. First one, the standard GBR procedure, like put bone graft material and then covered with collagen membrane as a barrier. So like the stabilizing suture, the overlying the membrane, and the plaque closure. That is ordinary style, the traditional, the GBR style. And yeah. However, there are many modified procedures to make volume augmentation. Volume augmentation is not the same meaning as a GBR procedure, right? So a little bit different. So Dr. Chung is make a pedicle plaque from palatal plate, palatal gingiva. So not free connective tissues. Actually, this one is have some the pedicle, the palatal pedicle. So this pedicle is very important to make us blood supply. Okay, there's the connective tissue graft is not free, just holding the palatal pedicle. Some part of graft material, some part of graft is holding the palatal plaque. So this the palatal, the pedicle areas supplying the blood supply to these connective tissue graft. Okay, now he is making a suture net. Yeah. Suture net. Okay. So generally speaking, the after healing stages, this lateral incisor, like this lateral incisor depression, defect area, the shrinkage, right? So the over-contouring for volume augmentation procedure, the over-contouring is necessary part. So we can use like graft material style, osteogenic collagen or osteogenic collagen. These collagenated bone graft materials will be available for making volume augmentation on this depression area. Another way is here, a connective tissue graft like this, today's surgery. And finally, we can use this collagen graft, thick type, right? Not thin. A thicker type is better to make volume augmentation. He made another nut. He is making another suture nut, the distal portion of implant fixture. So blood, the bleeding. I think small arteries as cut it. So palatal bleeding the continuous palatal bleeding is appeared. Right. So when we have this kind of the blood, the artery cutting or small vessels cutting, so continuous blood, the bleeding case, first step, we have to make pressure dressing, the pushing, the strongly, right? Pressure. And second one, using like a bobby. Third one, we can use like the hemostatics. The bleeding is still continuing here on the palatal side. So Dr. Chung is using the bobby, the electrosurgery, to stop blooding, to make a stop blooding, blood bleeding. Okay. Pushing into the labial side of the pedicle graft, and then using the bobby. Okay, so he is continuing to make a suture, another knot on the labial portion. So he is trying to make a suture to stop bleeding. Suture pressure dressing using the bobby, like electrosurgery like a bobby, and the chemical agent. All of these are useful to stop the bleeding. In case of blood, the artery cutting or the small vessels cutting. Another sutures applied for making stop bleeding on the palatal side. The collagen graft too is applied on interdental papillary area between the implant fixture and the first premolar. Okay, another suture. So in future, we hope this collagen graft too transforming the natural interdental papilla. However, if you want to make interdental papilla, you have to do something more. Okay, collagen graft 2 was applied this interdental papilla area between 13 and 14, and the bleeding still continuing here, the palatal side. Yeah. Today's surgery have only one implant fixture installation on number 13 area. This number 12 area, lateral incisor area, will be made by cantilever style. Right? In case of tight, narrow space, the horizontally, the medial-distally, it is impossible make a two implantation. because of it is not available. We don't have any the enough space, the available space to implant fixture this the procedure. Finally, we're gonna make a cantilever style. The final restoration will be good. So your basic knowledge is here. Between fixture to fixture, 3 millimeter, the way each other, right? So not enough space case, actually one implant and the cantilever, the final restoration is best concept and best choice. Okay, the surgery was done successfully, and then we will have a 10 minutes break, and then we will have continuous the prosthetic procedure. Thank you. Okay, let's see the post-op situation. As you can see, this post-op the surgery photos showing us about this suture and the soft tissues status. Especially, as I mentioned before, this collagen graft 2 inserted between number 13, implant inserted area, and number 14. In future, we hope this collagen graft 2 promoting or contributing to make reconstruct into dental papilla. However, it not fully reconstructions will be happen, but the small portion that will be recovered because of this collagen graft 2 contribution. What about this panoramic view or post-op panoramic view and condom CT view? The panoramic view showing us about depths of insertion of implant fixture. Ordinarily speaking, as you know, the top portion, in case of bone level, the top portion, bevel portion of implant fixture should be located under 3 to 4 millimeter from the neighbor CJ line. So we have to focus on this demarcation line, the thread areas starting the platform, right? So this one is beveled external connection style. So the reference line is different compared to bone level. However, we're focusing on this top portion of thread. And about this condom CT, the angulation and position and the labial bone plate was good. So maintained very well. Looks good. Also, the post-op healing photos connected with this digital abutment with implant fixture. So the neighbor area, what about this keratinized gingiva? Thicker labial side of keratinized gingiva zone is in future contributing to make healthy this prosthesis and the pontic area. So hopefully this between 13 and 14 area interdental papillar tissues to maintain and stay there with a strong and enough dense the collagen fiber connective tissue style. However, what about the 12 area, the lateral incisor? We talk about these areas have some big depression, so we need some procedure to maintain or the augmenting volume enlargement, right? However, today Dr. Chung is finished with this kind of simpler way of surgery. Just put implant fixture on certain area using the bright TL and the simple pedicle graft with collagen graft 2 inserting between the membrane, between the outer flap and inner bone surface area. So if you want, if you make more enlargement, this labial depression area, we need more. We need something to do more, like bone grafting more, or some GBR procedure more, or some another connective tissue graft more. Okay, due to the CAD view, the final processes will be fabricated like this style. So a little bit looks like a longer the panic area lateral incisor. However, we can reduction after and after the after surgery. Maybe in future we can reduction to make a shorten this cantilever area, the panic area. the gingival molding status, the gingival molding situation on the lateral incisor area, have some the ovate panic style depressions was appeared due to this soft tissue management using this temporary prosthesis. And also tie base and the temporary is contribute to making a gingival molding. However, the focusing on these lateral incisor areas is still the lackness of tissue volume. However, this patient age 78, right? So I think a patient is satisfied about this final result. And the cantilever lateral incisor area, and the final prosthesis looks good. And if we want more, due to the patient, the necessary part with the patient agreement, actually central incisors will be restored with a new crown with a little bit the longer the crown length, and the shortened lateral incisor, the panic base, and the soft tissue graft or the bone graft insertion will be tried on this lateral incisor area. Tunneling technique also available, and some bone grafting materials will be inserted during tunnel, right? Osteon 3 collagen or some another collagenated bone also available and useful, very useful when we have a tunneling technique to enhancement, some depression on lateral incisor area. So looks better and looks good. However, let's think about the patient age. Elder person should want to have a simpler surgery. They don't like a big surgery, like a full thickness flap, reflection, and big surgeries with the GBR procedure, make a big flap. So they don't like anymore. So we always consider inside of a patient the position, right? So that is sometimes we need some negotiation between patient needs and our goal. Anyway, today's surgery's key point is a simpler way to restore this anterior missing area on case of elder person. I think the follow-up was good. Okay, so we can see clear and more the precise these canine areas final laceration using this zirconia, the cantilever bridge type, cantilever crown, 12 and 13 area. Good, looks good. Okay, thank you for today's surgery. I always thanks to Dr. Chung to give us a good surgery and simpler concept. And today's question is here. How do you stabilize collagen graft 2 during the surgery? And do you adjust the thickness or size per use? Basically, collagen graft 2 is just tugging and inserting between flap and the underneath the bone areas or some denuded area, right? So this collagen graft is not necessary to maintain the stabilize using the pin or overlying suture. However, if you want, you're gonna do the overlying stabilizing sutures will be available. However, in case of pin fixation, have some difficult cause of this collagen graft 2 is a little bit softer and brittle. So when you apply this pin fixation technique, maybe this collagen graft 2 may be a little bit fragile and the squeezing the collapse down the thickness. So for me, I always use this collagen graft 2 just inserting between the overlying flap and underneath bone grafting material. So I always use this collagen graft 2 combined with collagenated bone like osteogenesis collagen or sometimes I'm going to use ostensibly collagen as the volume maintenance, right? So collagenated bone and the collagen graft 2 and flap covered and just interrupted suture or the horizontal matrix suture is enough, right? If you want, you can do, however, you can do the overlying the sling suture over this collagen graft too. Okay, so the main concern is simple application. When you choose using this collagen graft 2, the key factor is simple usage. So the complex sutures doesn't necessary. It is not the matching to the basic concept using the collagen graft 2. Okay, so thickness, about the thickness is enough. However, sometimes we need a little bit the squeezing and dense collagen matrix type when we have some socket preservation, ARP, or some ridge augmentation case, or some another the specific procedure case. If we can use these thicker and dense collagen matrix materials, I will use this one for the specific reason. However, nowadays the collagen graft 2 is enough available to apply this ARP procedure, some the ridge augmentation procedure, and sometimes the open wound healing style procedure trial. Okay, thank you for watching today's live surgery and follow-up. The next live surgery will be held April 1st. Operator will be Professor Cho from Seoul National University. Okay, we can expect about this very nice soft tissue surgeries by Professor Cho. Thank you for watching today. 谢谢大家，拜。